Hey guys, I'm Dr. Utash, Wellness Key Chiropractic. Now a lot of people are curious as to how chiropractic works. Well, a chiropractor is simply looking at their spine, looking at a patient's spine to see if any of the bones have either become stuck or fixated or out of their normal position, which creates stress and irritation on the central nervous system. Now this is extremely important because if you think about it, if you've ever broken a bone or perhaps broken a bone near a joint, if that joint doesn't get moving after you get the cast off, what's going to happen to that joint? Yeah, it's going to get stuck. And it doesn't matter if you're 5 years old or 85 years old. If you don't move it, you lose it, right? And so the spine is a series of bones and joints that all should be in movement, right? And so there's 7 bones in your neck. Every one should be moving independently. 12 in the mid-back, 5 in the low back. Then you have your pelvis and your sacrum, your tailbone, right? So when any of these bones become stuck or out of their normal position, this puts a ton of stress and strain on the central nervous system and bad things happen. For example, top bone right here at the base of your skull, right, goes around your brain stem. Oftentimes if this thing is positioned, because maybe you have some forward head posture because you've been looking at a computer screen too much or looking at your cell phone. This puts stress and irritation on the nerves at the base of the skull, which wrap around and can cause headaches. Sometimes even brain fog. Sometimes we see patients with irritation or stress on the base of their skull and these nerves here, and they have sleeping issues or inability to focus. So a chiropractor simply assesses the spine for fixation with an x-ray or with their hands, right, and measuring ranges of motion, and we're able to see which ones are working, which ones are not working, right, and with an x-ray and with posture we can see, is it in the right position or is it out of its normal position, where is there stress on the central nervous system, and then we, with a simple, very specific adjustment with our hands, a table, an instrument, we're able to take and move that spine closer into its normal position, right? Whether it be one segment at a time or traction and really just getting that spine back up to its normal position. We take stress and irritation off the nerves, and then the body is able to heal itself, right? And so whether it be taking stress off the nerves in the base of the skull and you're able to think clearer, have less headaches, maybe it's you're pinching the nerves that are going into your arm causing numbness and tingling, carpal tunnel-like syndrome. Again, by shifting the spine off those nerves, right, you're able to take stress and irritation off those nerves and allow the body to heal itself. Again, this is Dr. Joe Utash, Wellness Key Chiropractic, and the basics of how chiropractic works.